Once again, we're back here with Dr. Carlos Montenegro. We are on Healthy Living, and we're at Coastal Carolina Hospital. We're talking about hernias today, which is actually really interesting, and I think something that many people have heard about, don't really understand. I've gotten a lot of information just listening to you today. It's fun to watch everybody walk back and forth. They're all curious about what's going on today. Let's talk a little bit about, it's a procedure called the TIF procedure. And I'm curious about that because I've heard nothing but raves about it and what you can do.
Yeah, the TIF is a procedure for patients who have gastroesophageal reflux disease.
Ooh, gastroesophageal reflux disease. Okay, GERD.
Is a fairly predominant condition in the States. About 20% of the population, the adult population, has some degree of reflux, and a lot of them take medications. A lot of them are associated with hiatal hernias, the other type of hernias we talk, where the esophagus starts going up and the stomach follows, and that opens that valve that we have to prevent the acid from coming up.
Why are so many of us getting this reflux?
Well, we're gaining weight.
Oh, right. Oh, here we go. I know.
All the same factors: constipation, having problems urinating. All of that is going to stretch. If the other muscles are okay, this muscle is kind of weak, especially in women. Then the opening starts getting bigger and bigger. I've seen patients who had the whole stomach in the chest, and they barely had symptoms until something really bad happened.
Exactly.
So.
Is there anything you can do to prevent that from happening?
Not really. I think it's just
it's genetics, luck of the draw. Okay, all right.
It's going to happen. Of course, maintaining a healthy weight plays a big role because then you're not stretching these muscles and opening this natural orifice and allowing things to go through.
And it makes sense when we talk about that. It's weight reduction or healthy weight, eating healthy food so that everything's moving the way it needs to be moving, exercising, which I know. It's all the things that
everything that gives more tone to the muscles, and then it's harder to get a hernia.
When is GERD or reflux most felt when you're laying down?
Yes, because there is a natural mechanism that stops the acid from coming in the esophagus.
Okay.
Because the esophagus, the lining of the esophagus is not equipped to handle acid.
Okay.
As is the stomach. So whenever you lay down and you have a small hiatal hernia or a weak sphincter that we call, then the acid is going to come in the esophagus and it's going to cause irritation of the esophagus, which we call esophagitis, and that could lead to ulcers, narrowings of the esophagus, bleeding from the esophagus. And if it doesn't stop there and goes to the upper respiratory ways, patients wake up coughing, they have worsening of asthma, they have laryngitis.
What about sleep apnea?
Sleep apnea is mostly related to the obesity.
Okay.
Being heavy and having to breathe.
I've heard
harder.
Barrett's syndrome.
Barrett's esophagus is a consequence of chronic acid reflux, years of acid reflux, and that lining that we mentioned before changes to something that resists the acid there. But that carries a risk of developing cancer in that change lining of the esophagus.
So what are our options? Because from people that I know who have GERD and reflux, it is not a very pleasant thing to have over time.
No, it's not, and some is a disease that can present in different ways, from coughing, from feeling the heartburn, the acid coming up, sometimes feeling food and digested food coming up to your mouth.
I've never had it, so I'm trying to understand what that feeling is.
The feeling
burning?
Is burning. Sometimes it could be kind of pressure. Sometimes the patients think they're having a heart attack.
That makes sense, yeah.
They go to the hospital, they run all the tests for the heart, and it's not the heart, it's the acid reflux that is affecting the esophagus.
So this TIF procedure for this hiatal hernia, correct? What is that?
For the reflux. Okay, so there are different options to treat gastroesophageal reflux.
Okay.
The first medication, the first is change the habits.
Right.
Eat during normal hours. Try not to eat 2-3 hours before laying down. Maintaining a normal or acceptable weight, and not drinking, especially at night, coffee, chocolate, things that are going to exacerbate the acid reflux. So that's the first thing to do. Then there are medications, and over the years the medications have gotten really good, so much that years ago we used to operate a lot of patients for peptic ulcer disease, another problem with acid. But nowadays, because of these medications that suppress the acid from the stomach, we don't do as much operations on peptic ulcer disease.
Okay.
But now these medications do the same for acid reflux. And there are patients who are taking medications for years and years. And these are medications that are not supposed to be taken
for years and
for
years.
A long time because they have other side effects. Now, patients who have a small hiatal hernia, they are the ideal candidate for a TIF.
Okay.
TIF stands for transoral incisionless fundoplication. So
a fundoplication sounds.
It's a fundoplication. But all of this is done through an instrument that goes through your mouth and your esophagus and recreates this mechanism to prevent the acid from coming up.
It's like an endoscopy kind of thing?
It's an endoscopic procedure.
Okay.
So there won't be any
wow,
incisions.
No
in
incisions.
The belly.
Okay.
Okay, and we achieve a repair of this mechanism. Ideally, we try to do it like 360 degrees all the way around the esophagus, but this gives a good 270 degrees.
Okay.
Which is going to control the acid reflux and is going to prevent some of the side effects of the laparoscopic fundoplication, in which we do the 360. The worst complaint that patients have of this procedure is the inability to belch.
Okay. Well, that makes sense with the air and...
Right. With the 270, they don't lose that. And that is cited as one of the most beneficial components of TIF. The way I see TIF is we have medical treatment, and then we have surgical treatment with the laparoscopic fundoplication that we do in this hospital robotically. And now we have something in the middle for those people who are extremely afraid of having an operation.
Okay.
And don't want to take medications every day.
Oh, it makes so much
TIF
sense.
is in the middle right there.
What is an actual fundoplication? What is
fundoplication? We go inside the patient's abdomen, we free the stomach, and we cannot do a wrap around the esophagus.
Okay, a lap. Okay, okay.
To prevent the acid from
going up.
Going up. With the TIF, we don't do the full wrap, just like 270.
So am I folding it? Am I
folding it? Yeah.
Oh, am I? Okay, I literally am.
Folding the stomach over the esophagus.
And from a treatment protocol longevity point of view, how long does that last?
That's an excellent question. This is not a new procedure. It's been there about at least 10 years from what I know. And the duration, and recently there are studies coming out with information about this, is patients have good resolution of symptoms, about 80% up to 10 years.
Oh my God, that's amazing.
And with the laparoscopic fundoplication, the reports are 85 to 90%.
Okay, so we're still
up
within
to
the
10
same.
years. So very acceptable if you don't want to take medications every day and want to prevent the side effects of these medications.
When people come in to see you for things like that, do you find that your consumer population is much more educated? Because I think even doing shows like this, I feel like for many of us, this has given us insight, not just terminology. I feel like I have a much better awareness from what you've said that there are options available. I mean, you've intentionally said here are 3 different options. Is that how you manage patients now, often with things like this? Here are your options.
Yeah, we had to, and we try to keep always that situation. Okay, you can select any of the options.
Exactly.
It's your decision. We're not going to tell you what is best. We're going to tell you what we recommend. But these are your options. So if you're really afraid of an operation, and don't want to take medications every day, then you
Yes.
have this other option. This is a new procedure we just started.
Well, it's
at
great to
Coastal
have it here.
Carolina
Yes.
Hospital, and we're trying to do more of it.
Well, it is always so much fun to talk to you. And again, the way that you explain things is so user-friendly, so many of us really will come away with this with some information that we didn't have. Again, Dr. Montenegro, thank you so much for
Thank you
joining
very
us.
much.
We want to thank all of you for joining us here on Healthy Living here at Coastal Carolina. Bye-bye.